all of the questions are going to be on the screen right here. Good evening to everyone. Certainly we are grateful to come to you from the sanctuary of the Mount Pisgah Church. Tonight we are live via our live stream, Facebook and YouTube. As tonight we've set aside some time to get some answers to some questions concerning the COVID-19 vaccine, and certainly there are many questions. People have so many questions that they're asking right now, so we want to take the time to just spend some time with these two gentlemen that are with us tonight. I'm grateful to have two of our friends and brothers in the fraternity. Both of them work daily within the hospital system, and so I want to introduce to everyone tonight Dr. William Sam Greenfield and also Dr. Nicholas Tinsley. We're grateful that they have taken time out of their schedule to share with us tonight. Again, so many of you that are members here at Mount Pisgah have been asking questions. Many are afraid to take the vaccine, and because of that, we wanted to just set aside some time to try to calm your fears and to just get you some answers to the questions that you have been asking. I do believe that, as the Bible says, that our people perish because of a lack of knowledge, right? And I think during this pandemic season, many don't have the information, and so we want to just take the time as your pastor, as your church, to just share with you some things that may help you in deciding to take the vaccine, and just to kind of clear up your thoughts and fears on this vaccination. So certainly we want to get into our time together tonight, and so what I want to do again is introduce these two gentlemen that have consented to share with us. And I'm going to just give them some time, to just a few minutes, to introduce themselves and just share with you what they do. And so, first of all, to my right, I want to introduce my friend and brother, Dr. William Sam Greenfield. And we're going to just give him just a few minutes to just share with us who he is and what he does.
So, good evening, and thank you for having this and for the opportunity to talk to your members and to talk to anyone who is interested and to anyone who has been affected by COVID, and I think it's safe to say that that is everyone. A little over a year ago, the state of Arkansas began to investigate the first few cases of possibly COVID, and in March we had our first case. Nobody had heard of SARS-CoV-2 at that time, likely, and hadn't heard of COVID-19, and there was discussion, well, maybe it's like the flu. And here we are a year later, and in our state, 300,000 people affected have had the disease, 5,000 people dead from the disease, people separated from their friends and family at the most precious times of childbirth. You can't be there quite often, all the family can't be there. And in times of loss, you can't be there. And all of the things that make life precious have been challenged. And so we're in this crisis, and it's sometimes difficult to make decisions under duress. And so I hope that through conversations like this, we can begin to provide some guidance, some light, if you will, because we do have some light in the form, in my opinion, of what this vaccination offers. Because while we've had social distancing and washing hands and wearing masks, and masks are just as much a part of our lives now and for the foreseeable future, the vaccination is one of the best things that we have as an option to get through this. So thank you for the opportunity, but I will encourage folks to please ask questions if you have them, and we'll answer the questions that were submitted, and hopefully this will help you make a decision that will protect you and those who are precious to you.
All right, okay. Brother Tinsley, Dr. Tinsley.
Yes, sir. Thank you again, Pastor Collier, for having us this evening. Name is Nicholas Tinsley. I'm a critical care clinical pharmacist at the VA hospital in Little Rock. Just to kind of piggyback what Dr. Greenfield said, we've been dealing with this almost going on right at a year here for long. We've seen a lot of cases of COVID. I see these patients on a daily basis, and it's definitely been taking a toll on us all, whether you're a healthcare provider, essential worker, loved ones been infected with it, someone you know may have been infected with it, co-workers. We're all in the fight together, so hopefully we can get provide some good information this evening to, again, address your concerns, and hopefully, give us a good outcome and start to get a lot of people vaccinated.
Okay. All right. Again, thank you both for being here. And certainly we want to make the most of our time together tonight. So we're going to get into the questions that have been emailed to us, to everyone who's watching via live stream, Facebook Live and YouTube Live. Just want you to bear with us tonight. We have approximately 20 questions that we're going to be answering tonight. And again, we're going to, if you have any other questions after tonight, we ask that you would just email us, and certainly we will be able to reach out to either Dr. Tinsley, Dr. Greenfield, to get any information that you may need. So as we get into our time together, our first question tonight, and I hope you all are able to see it as you're watching via live stream. Our first question for Dr. Tinsley and Dr. Greenfield, can you discuss the overall safety of the vaccine?
Yes, Pastor Collier. So to give you some information, overall, the safety data has been pretty good to my understanding from CDC, from both the Pfizer company and Moderna. Most of some of the adverse effects or side effects you're seeing patients reporting just localized muscle pain. But overall, there's been a really good, more like flu-like symptoms, and when you got to be careful when you say flu-like symptoms, but maybe a slight fever, just general malaise or just tiredness, and just maybe a slight headache, but nothing that's been life-threatening. Obviously, people who have a risk of having an adverse effect, I think we'll talk about that, or a bad outcome from previous vaccinations or had a history of adverse effects or allergic reactions, if you will, to in the past to things in general or to vaccines have not necessarily had a death or anything, but they're a little bit more at risk. And so that's something to take into consideration. But overall, the adverse effects have been not that prominent like you would think. So.
Okay. Dr. Greenfield, did you want to add anything to that?
No, I'll just echo what Dr. Tinsley said. We will learn more as we go forward. Thousands of people were in the original trials, and now millions of people have received the vaccine. So it won't be surprising that we will learn more as we go through this. But of the tens of thousands of people who were in the original trials, the safety profile was there. Some of the things that people will describe as adverse reactions or reactions, some of them are simply the immune system responding and doing what it's supposed to do. But the overall safety profile has been good, but we will learn more, and I don't think we should think that we won't learn more as we go forward. Okay.
All right. Well, I think this is kind of, this question is along those same lines. What are some of the side effects that have been reported? And so I think that answer was pretty clear in our first question. So question number 3, what should one do if they have an allergic reaction versus, mild versus severe? So Dr. Tinsley.
So that's a good question. So most places are having you to wait at least 15 minutes after getting your injection. Again, these vaccines, the Moderna vaccine and the Pfizer vaccine, were issued what they call under emergency use authorization, basically saying that there's going to be an extended period. There's not like you can go right now maybe to your local pharmacy and get a flu vaccine, and if you had one before and you haven't had a reaction, you can wait. They'll ask you to wait 15 minutes. In the case if you've had an allergic reaction or allergic reaction to a vaccine before, they'll ask you to wait about 30 minutes more just to be certain. Most places, if not all, are doing this. Spoke to a friend of mine who's a pharmacist in my hometown, Forest City, Arkansas, and he's saying that's what the guidance they've been given as well. In the event that you do have an adverse reaction, a lot of people who have allergies or the children have allergies, they have those EpiPens. It's called epinephrine is the name of the medication, but they know them as EpiPens or Epi Juniors. They can use that. That medication helps to open your airway up and, stop the allergic reactions for the most part.
Okay, right, okay, all right.
I agree with all of that.
Okay,
Yeah.
all right, all right, okay. Question 4, when should one seek medical attention for allergic reactions?
If you receive the vaccine and, I typically say, if you feel like you need to go to the emergency room,
Absolutely.
go to the emergency room. Yeah. That would be number one. But particularly if you are having swelling in the airway, difficulty breathing, you're breaking out and you are having a very severe reaction, then what you perceive as a severe reaction, I would say don't hesitate to go. But most of the reactions, those types of things we would see during that initial period of observation. If you have a history of an allergic reaction, a severe allergic reaction, typically it'll be a period to be observed for about 30 minutes. If you have known allergies to the ingredients in the vaccine, that would be another reason. And there's one ingredient in it, you may hear it called PEG, or polyethylene glycol. If you have that allergy, then that would be, you may want to avoid this current setting.
Okay, all right. Well, to kind of piggyback on that, let me ask this. I know some people have food allergies. My sister in Las Vegas is allergic to eggs.
Yes, sir.
So does this vaccine, is it, if you have that allergy to eggs, is this vaccine, does it contain eggs, or, I may not be asking the question.
Well, no, I understand exactly what you're saying. So that's a good question. So no, this vaccine is a novel vaccine in the sense it's never been done before, which is a good thing and a bad thing. That's just not necessarily a bad thing, but this is new territory type of thing. And so traditionally, just because of the size and amount of, so take for instance, you mentioned egg vaccine, influenza vaccine. So they use it, they make it in chicken eggs. And so part of that comes along with that, some people have a reaction because they make in the bulk that they have, the amount of vaccine that's required, they grow them in chicken eggs. And so you do have some patients who have allergies to eggs who will have a reaction just because of the way the vaccine itself is manufactured, but that's not the case with the Moderna and the Pfizer vaccine. They're all genetically made. It's just a vaccine that's not made in any animal part, so you should be okay if you have an allergy to food right now. So.
Okay, all right. Okay, our next question, once vaccinated, will Tylenol, Motrin, or any fever-reducing pain medication be required?
Not required, but it may give you some relief of some symptoms. A lot of times I'll say start with something minor, a cold compress on the injection site. That may give you some relief. Tylenol and ibuprofen, that may give you some relief. But the need for these medications afterwards, that is not necessarily the case. I can speak from what the data said, but I can speak from my personal experience. I got the shot, felt like a flu shot. It ached a little bit, but it did not disrupt my day in terms of having to take a day off. And everybody's experience may be a little bit different. So that's why I say not required, but may be useful if you have symptoms.
Okay, Okay, all right. Well, will this be an annual recommended shot like the flu shot?
That's a great question. And so I'm sure Dr. Greenfield can kind of, the short answer, if I had to hedge my bet, is like, we really don't know. But if I had to have a professional guess, I would say yes, more than likely, at least until we get past this initial novel COVID vaccine, this new, when we say novel, we mean new vaccine. Nobody's ever seen this virus before. And so what some of the information that's available that some of us have access to, some don't know about this, but this is not a new virus. Coronaviruses are, we've all had a head cold. At one point in time, we likely had a coronavirus. And if you think back to the early 2000s, you may have heard of SARS, or you may have heard of MERS, the Middle East respiratory syncytial virus. They're all in the same family. So the only thing difference with this virus is we haven't seen it before. Nobody's seen it. So whereas mostly patients in the Far East, as far as Asian countries, they've had this virus for a while. Some of us may have had SARS or MERS and never knew it. But likely this is going, for the foreseeable future, I would say it's probably going to be likely we're going to have some form of vaccination moving forward.
Okay. So coronavirus is not new. It's nothing.
So when you say coronavirus, it really speaks to a family of viruses, but essentially coronavirus, the symptoms that we see, and so just to make a point of clarity, it's not necessarily the virus that causes the issue, as my understanding has it. So it's more of the immune response, or how your body reacts. So your body has white blood cells, they fight off the infection, they keep you sick. So if you get a head cold, you get the flu, you have some type of infection, skin infection, your body produces those white blood cells to help isolate the infectious, whether it's fungus, whether it's bacteria, whether it's virus, to kind of wall it off, to fight it off, to chew it up and get rid of it. The virus itself doesn't cause issues, it's the body's response to it. So to answer your question, yes, they're not new. We've probably had some coronavirus in our life, but not this one.
That's right. So, like he mentioned, coronavirus is a family, and he mentioned SARS back in the 2000s, and it hit the Far East. It was SARS-CoV-1. Then there was, now we're talking about SARS-CoV-2. That's the name of the virus, and the coronavirus disease of 2019 is COVID-19. So that's the disease. And when the body sees this invader, it can go crazy. And it will release a immune response in every effort. And when the virus comes in, while we think about it getting into the lungs and mostly being a respiratory problem, it can set off a series of events that may not just be confined to the lungs.
Absolutely.
People may have respiratory problems, we may hear of pneumonia, but what we've discovered is people will have blood clots, which increase the risk of things like stroke. It may increase the risk of having other systems shut down. And what we haven't totally figured out is, why does it affect this person and like this, and they have a mild case, and why does it affect that person and they have a very severe case? And it may have to do with how much virus they got exposed to, because once the body gets in, this virus cannot live without a host.
Absolutely.
Okay? It's got to have a host. We are the machinery, or whoever it infects is the machinery. It will infect the body, bind onto a receptor, and I think about the binding almost like a Velcro being thrown at a ball being thrown at a Velcro glove, and it hits it and it sticks. And then it gets in, and then it begins to replicate, begins to reproduce. And every time it produces more and more, the body's immune system is in this battle. These soldiers that your body is now trying to recruit to fight the infection come on full force, and the battle is on, and we're simply the battlefield.
Absolutely.
And we are the casualty can be a casualty of what's going on. So I hope that kind of paints a picture for where we are.
Okay. Dr. Greenfield, along with that, I've heard and seen, I know many of you may have, who are watching now, may have seen the University of Florida basketball player who, after, I guess, suffering a case of the COVID-19 virus, he collapsed. And I guess a result of him having the virus, I think they diagnosed him with, I believe it's called myocarditis. Have you all heard anything, especially with our athletes and younger people?
I don't know that case particularly, but to break that down, whenever we hear itis, regardless of where it is, that is inflammation.
Absolutely.
That's an inflammation. That's an inflammatory response. That is the body's effort to say, I don't know what's going on, but I don't like it. Okay? And myocarditis means the myocardium, that's referred to the heart. So his heart became inflamed as a result. Now, I don't know this case particularly, but we've seen that is what part of the things that we've seen. And in fact, while we think about children being, well, we say, well, this is something that hurts old folks. There have been reported cases of children having myocarditis type symptoms, inflammatory systems. So, and I think that point goes to the point that no one can just simply say that they are safe from this, or no one can say that, well, my case would only be a mild case. I would venture to say that a college athlete at the University of Florida was probably in better physical health going to this than most people who are listening to this broadcast.
Absolutely.
Okay. All right. Are there any reputable websites that we can visit to continue receiving up-to-date, accurate information concerning the vaccine?
I'm sure Dr. Greenfield would agree with the CDC website is the absolute best resource for up-to-date information. They have information regarding the availability of the vaccine, what's going on with trends with the virus itself. I know in the last few years there's been a lot of distrust of public information, but the CDC, their sole purpose is to protect us from infectious disease. And so they're going to have that's probably going to be, there's always going to be this source and that source, but the CDC is probably going to be a great resource at this point in time.
I agree with that. The Department of Health, and I didn't mention part of where I work at UAMS, where I'm a professor in the College of Medicine, and I also work at the Arkansas Department of Health as a medical director there. The healthy.arkansas.gov is the Department of Health website, and you can get up-to-date information. And there is so much information when you click on those banners, information that will get down to the level not only of the number of cases or the number of people we have lost, it will get to the information, if you navigate the system right, how many cases at this long-term care facility in this county. So if you have a family member that you may have in a long-term care facility or maybe looking for placement, you may know, what were the cases in this county? How many cases were in Benton or Saline? How many cases in Pulaski or Sebastian County? That information there. A general rule, not an absolute rule, but there is so much information out there, and this information can become overwhelming.
Absolutely.
And you begin to say, who do you trust? Because that's at the key. Right. You're listening tonight because you trust your pastor to say that we are reputable sources if you don't know us personally. Right. So trust is important. But as a general rule, I would say that if you see a website that ends in .gov or .edu, those are going to be websites that I would say I would tend to trust but verify. But other sources, while passion may be there, it doesn't necessarily mean that passion correlates to accurate information.
Right. Absolutely.
Okay. All right. Okay. Question 8, and I know I have heard this question: will social distancing, etc., still be required once you've been vaccinated? And I think that's really an easy question to answer. And I can say yes, but I'm going to allow these professionals to elaborate more on that. So.
Yes, sir. So to answer that question, so the short answer would be yes in the short term. We just don't know how long and how effective, for how long the vaccine. We know that the vaccine is effective. Moderna is around 95%. I think Pfizer's around 98%, but that's way above what you would consider to be an effective vaccine. The issue that you're going to run into with this particular situation is because it's a newer vaccine, we don't know how long that if you were a protection, it's going to be available. And so right now we know for a period of time, they can't quantify, they won't quantify, because as soon as you put a number on something, they're going to say, well, you told me it was 6 months, and now at 4 months I got, I may have come down with it. And, it's just all just the data amount of information that's coming available after the vaccination. So the short answer is yes, you would need to continue to social distance, keep doing the things you're doing, washing your hands, wearing your mask, but moving forward, as data becomes more available, they can say, okay, at this point, and I'm sure Dr. Greenfield will speak to it, what they speak about herd immunity, everybody talks about herd immunity. And so what is herd immunity? Herd immunity basically meaning this set point where we consider, whether through vaccination or exposure, you've reached some type of overall in the whole country, or, in some places, if you're talking about World Health Organization in the world, what do you consider that if we reach to this point, which, I don't want to quote the number, but the CDC has a number where they consider this exposure or this herd immunity to be achieved. And so the short term of it is, as vaccination becomes more available, as they move through the initial 1A, 1B, 1C, it'll, in the short term, yes, you would probably need to continue to social distance.
Okay. Dr. Greenfield, did you want to speak to that?
Yeah, sure. So as Dr. Tinsley mentioned, the herd immunity, an example I will kind of give for those who don't truly grasp the concept, what we'll say is herd immunity. You may say community immunity.
Yes,
so
sir.
Let's say we're the herd, we're the community. And the pastor has not been infected, and the pastor has not been vaccinated. And let's assume that I have been infected and I have recovered, and Dr. Tinsley has been vaccinated and he's immune. And we have both recovered, so the likelihood of us contracting this again is low, is decreased. And you're only around us. So if we can't get it, and you can't get it, and you're not around anyone else, then you won't get it. So that's the concept.
Yeah.
So where we are right now, I think the number is around 10% of the United States has been vaccinated. Okay? And the goal, we will say, is about 70% before we say that the herd has been effectively vaccinated.
Right.
And what will that mean? It will mean that for those people who have not been infected or have not been vaccinated, enough people around them have been vaccinated or infected that they are then protected. So will we be with the mask and the 3 W's, mask, washing, and wearing? Yes. And then likely when we get to that 70%, it doesn't mean that it's just going to magically go away, because it will likely be, well, let's see.
Yeah.
And then at that point, I may ask Pastor to take his mask off first, and I'm going to just watch see how he does.
Okay, all right. What if you've tested positive for COVID recently? Should you still get vaccinated?
So I would say if you have been recently tested positive, you really should go through your period of isolation and recovery before you get vaccinated. You need to get through that period. And then there's thought to be at least about 90 days of protection once you've been infected and you recovered, that you may be protected from developing a reinfection. Now, that being said, that's sort of a guidance, and it's not an absolute that you cannot be vaccinated within that 90 days. But if you're in an acute phase, a recent phase of infection, then you should not vaccinate in that immediate window.
Okay. Right.
Yeah, I would agree with what Dr. Greenfield says. You do have some level of protection within that 90-day period of time, so vaccination is an absolute. That is not to discourage anyone, of course, from getting a vaccine if they've been infected. So.
Okay, all right. Question 10, and I think a lot of people are asking this question. because if they're not in that 1A, 1B, and 1C, when can the general population expect to be vaccinated?
So right now, we're in 1B. And I will say, I encourage everyone to go to the healthy.arkansas.gov website and see their infographics, and they can be posted anywhere where people gather to read that information for themselves. We're in 1B right now, which includes teachers and individuals over 70. We'll go into 1C probably April, May, somewhere around there. And then exactly when we will get to the general population, I think we're several months away from that right now. And that's largely not to say that we don't know that folks need to get it, but it's a question of the constraint, the limiting factor is supply. And if there's not enough supply to meet the demand, then it doesn't matter what group you're in. So if we open it up and said to all comers, and without prioritizing the most vulnerable groups, the highest risk groups, then it would not necessarily make a difference because we would run out. The good part is we have two. There's a third that is on the way. The Johnson & Johnson vaccine should be going before the FDA within the next week or so, a couple weeks. And then in a similar process, what you'll see, the things to sort of look out for, you will see a press release or something which is saying, hey, these are the results of our vaccine, and they will say, this is what it is. And then more information will then be presented to a group called the ACIP, which is an advisory committee for immunization practices. They will review it, and then the FDA will make a determination. Now, and there are more that are in the pipeline to come. And as more become available, then I think you'll see a rollout. Also, in this part right now, in terms of making it more available, one thing I think about is that we're learning a system. I would say that everybody knows more about vaccines collectively than we ever have in our whole life.
Yeah.
And the folks who live in the world of healthcare, we study it in school and we work around it, and that's nothing new. But when I go to my barbershop, and my barber says, now let me ask you about this mRNA. Now what is that? I'm like, that's a conversation that I never thought I would have. Yeah. And I will say that is a good thing. That is a good thing, because that means that we are getting empowered and we're taking control and we're learning about our healthcare and we're beginning to make more decisions, informed decisions.
Okay.
If I can add just real quick, Pastor Collier. Something else that, I know is extremely scary and extremely frustrating. And so it's from a pharmaceutical standpoint of view. It's also, Dr. Greenfield mentioned supply and demand. So right now, demand is high and supply, they're running at full tilt right now. Something else which amongst pharmacists and other healthcare providers we talk about is those things that we need, those simple things that we need. So you need vials to put the vaccine in. You need different components. And so that's something else that may also prolong that wait. Hopefully, with the new administration, with the Biden administration, nationalizing the supply chain, those areas are going to be addressed. But, it's particularly scary. Hopefully it'll be sooner rather than later.
Okay, all right. Question 11, will this vaccine be effective considering the virus is now mutating and the new COVID strain?
Sure. So there are 3 different variants that we may see in the news. One is the UK variant, the South African variant, and I think the other is...
That's interesting. I couldn't figure it out. I was looking. I saw it last night when I was looking for it, but I couldn't find the location. It's P something. I saw. I know what you're talking about.
And I think it's out of Brazil. There are these 3 different variants that are there. Now, the thing to know is that it's not viruses mutate. This is why you get a different flu shot every year, because viruses mutate. But how, and the South African variant has shown to have some decreased receptiveness to some of the treatments, and some of the studies out of the Johnson & Johnson vaccine show that it may not be as effective against that variant. It was like 60-some-odd%, I believe, in the South Africa variant, but in the United States it was a little bit higher. So there is a possibility. But on the other hand, the vaccines have shown to have some effect against other variants that are out there. So I think time will tell how effective they are. Now, additionally, though, but that's when you stimulate an immune response, there are a lot of components in your body that are released to fight this. This is not, when your immune system reacts, it is not just a single, I hate to use gun metaphors,
Yeah.
but I will. But this is not a single bullet. This is a shotgun that your immune system will send off
Right.
to sort of fight this.
Okay, all right. Okay, what's your message to those hesitant or afraid of taking the vaccine to help ease the minds of its safety? What's the risk of not being vaccinated? And I think certainly I want you, Dr. Tinsley, to start off with that, and I say that because you work in the critical care.
Yes, sir.
And so you're hands-on with this daily. So if you can address this question first, and then we'll go to Dr. Greenfield.
Definitely. You know, not to be tongue-in-cheek, I don't really like me and Pastor Collier, luckily he was my fraternity brother, we built a rapport, and so we'll have conversations from time to time, but I can think back to the conversation we had about whether or not you should be vaccinated or not. And so, Pastor Collier said, I work in the MICU at the VA in Little Rock, and so we see these patients day to day, and so like I tell my friends, like I've told my family members, we know what COVID is going to do. And so the blessing is if you get COVID, you recover, you're back to work, at the worst you may have very mild symptoms, everything's great. But unfortunately, if you're one of those individuals who gets a very bad, or your body responds badly to COVID, we do also know what happens with that. And so I think one has to look at both the pluses and the minuses, the benefits and the risks associated with that. And so worst case scenario, what's going to happen to me? That's me and my wife. My wife's a nurse. We have a newborn son. We have a child, a young daughter who's in kindergarten right now. So we had to we sat down and had a discussion, and saying, okay, so what's the worst that can happen? We see it on a daily basis. You see people going to the hospital on a small amount of oxygen because they're having a little trouble breathing. And then sometimes they get better, they leave the hospital, that's great. Sometimes they don't, they worse and they require more oxygen. The lungs start to fail, they require to be on the ventilator to help supply oxygen to their body. And then you start seeing these other adverse effects like Dr. Greenfield was saying, where you start seeing the body, when it attacks, when it's at war, it's going everywhere. It's doing all it can to preserve life. And so you start seeing those other systems, your kidneys start to fail, issues with your heart, like you spoke with the basketball in Florida. And so it's called multi-system organ failure. And so once you start losing, you may can lose one, you may can have some issues with your kidneys, you may can have some issues with your lungs. But once you have two or more, the more systems, the liver, the lungs, the kidney, the brain, increased risk of having blood clots with this, because the body's in this state where it's trying to lock off and keep everything situated. You increase your risk of having blood clots, and so you have to take that risk. So me personally, me and my wife, when we had our discussion, it was like, what's the worst that can happen at this point in time? We know if we survive, God bless, thank you so much. But if the worst case scenario, what's going to happen? You end up with all of these issues. And even people who have survived that initial, bad outcome, and we were just speaking about this, they may, just because you survived doesn't mean you have recovered fully. And so you may have some impairment. We still don't know long term what the effects are going to be. And so once we weighed the benefits and the risk of taking a vaccine, we felt as though there was more of a risk with developing COVID and getting a horrible outcome than it would be to take the vaccine in the short run.
Okay, all right. Dr. Greenfield?
And I'll add a little bit to this and to say that, what's the message if you're hesitant or afraid? I think a lot of times we're afraid or anxious when we don't understand.
Absolutely.
And so I would challenge you to kind of go back to a point to get information, okay? And begin to challenge what it is that we are afraid of. And like Dr. Tinsley said, when his family had the discussion, the fear was the fear of the unknown of what this disease can do because you've seen it. But there may be a fear or anxiety about the vaccine because I don't understand it. There are a lot of things in my life that I trust that I do not understand. I'll start with my iPhone and my brakes in my car.
Yes,
So I don't necessarily understand something, but I can maybe get to a place where I can trust that it is. So I would say, seek the information that you need, get trusted information, reliable sources of information, and then try to work through to make that best decision that you have. If you are, if you have small children, if you have someone in your family who's particularly vulnerable, if you're particularly vulnerable, and there's something that is there that may be a benefit to you, I would say try not to let the fear and anxiety stand in the way of something that may be a good thing for you.
Okay. Well, Dr. Greenfield, and both of you can speak to this, and we were kind of talking about this in the office, especially from an African-American perspective. Many have looked at the Tuskegee and what went on with those men who contracted syphilis. And so this certainly, because of that, I think this kind of registers in the mind of many African Americans. And so right now, that fear is there. Can you kind of just speak to that?
When I say trust goes a lot to influencing our decisions, and I think just plainly put, black folks have a good reason to be distrustful of some of the things the government has done. Okay, we'll start there. And I grew up in Alabama. I'm from Alabama, so I've heard and I've known of Tuskegee my whole life. Yeah. So I understand what it is. But one thing that I will say that's a distinction that I'll draw between this situation and the Tuskegee situation. In the Tuskegee experiment, the Tuskegee syphilis study, men had syphilis, one. A treatment was available, two. And that treatment was purposefully withheld to observe the effects of the disease. This is a disease. There's a vaccination available, and some folks are willfully not getting it for fear or trust. And what we were discussing was, like, if I invert the question just a little bit, I'm going to say there is a disease. Let's assume that there was COVID. There's a vaccination, and we said everyone can get the vaccine except black and brown folks. Would that change how we trust or feel that there's value in the vaccine? Right. So I understand from a historical perspective, and I too will look with the side eye at the government. Absolutely. And particularly with some administrations who were less friendly, in fact, let me just flip it, were blatantly more hostile to black and brown folks. Right. Okay? Right. So I get that. But I have looked at the science. I recognize the limitations of the things I know and the things that we don't know because we will still learn. But I understand what this is doing, the vaccine is doing. And if I were to weigh the risk versus the benefits, the risk of this disease, I would say I look at the numbers, it's about 1.5, 1.6% of folks who contracted the virus will die. Okay? Now, somebody said 98% of people are going to live. I didn't say you were going to live intact and whole. I didn't say you were not going to be hit. Yeah, so that's sort of a different thing there. So that's sort of my perspective. I hope that answers the question. Okay. I guess one more point I'll make about Alabama. A native son of Alabama recently passed away, Hank Aaron. And there were some who said, well, had happened shortly after he received the vaccine. Was that the cause and effect? I don't think we can say that. Now, they did an autopsy. They said it was natural causes. That was why he died. And he was not a young man. Yeah. And so I think it kind of highlights the point, because in this time when we're talking all things COVID, we can sometimes lose sight of the fact that life is still going on and other
Right,
things
right,
can
right,
happen.
Right. Okay. All right, question 13. If a person currently has COVID-19, what effect, if any, will the vaccine have on that person? I think we kind of already spoke to that question. If you had a severe reaction to other vaccines, should you take the COVID-19 shot?
The short answer is yes, but be very cautious. And so that's why we're saying that increased monitoring period of time. And so you want to say monitor for 30 minutes. And when I say monitor, that just doesn't mean pastor to walk away or not. So if you notice anything, anything strange, if that you within that, I would say 7 or 14-day period of time, that's the most likely period of time you're going to see some type of reaction. So sometimes you have a delayed reaction. It might not be an immediate reaction. And so, in that 7 to 14 period of time, keep an eye on it. But if you've had an allergy or an allergic reaction or adverse effect or a bad effect to a vaccine, yes, be cautious, but that does not exclude you from receiving the vaccine.
Okay, all right. What do we do if we have food allergies and carry an EpiPen? I think we already kind of spoke to that question as well. Should we pre-med before taking the shot?
All the information that I've seen is recommended against pre-medication, so particularly the NSAIDs, ibuprofen, naproxen, Aleve, Motrin, to avoid it prior to being immunized. But so,
I agree with that.
All right. Should we just not take the shot at all?
I disagree.
yeah,
Hard
wholeheartedly.
stop.
Yeah, absolutely. It's just, like I said, I don't want the shock and all value, but it's just everybody, we'll have, water cooler conversations and say, okay, when are we can expect a return to normal? When can the congregation come back to the sanctuary? When can we vacation? When can we spend time with loved ones? When can we have those family gatherings that we used to? And it's kind of dependent upon us to a small. Some things obviously are outside of our control. So we can't necessarily, if we have a job that we have to go to and we're around individuals, we can't work from home, there's a risk of us contracting COVID if we have to work in close proximity to each other. One thing we can't control is whether we decide whether or not we get a vaccine. And so as soon as we can have some level, reasonable, acceptable level of what we talked about already, herd immunity, then life can will things ever get back to normal? That's a question, and a debatable question. Maybe yes, maybe no to some degree, but we can do our part, particularly African American communities where we know we're the underserved. We know that we're not always on the top of the list. We know we're at higher risk of developing hypertension, kidney disease, diabetes. And so we already have this information available that we are at an increased risk for a multitude of reasons, not just one in particular, that we're at an increased risk already of having bad outcomes. And so just getting that information out there, good, solid data, talking to people you trust, your healthcare providers who you trust, your family members who you trust, who have it's funny, I don't want to say this, but it's true. You hear all these conspiracy theories and you're like, oh, they're putting tracking devices in the vaccine. It's like, and you start getting all this misinformation and, people either going to react with love or fear more times than not. And so, like Dr. Greenfield has iterated more than once, if you don't know something, you're going to obviously, to a certain degree, have some level of fear, some type of trepidation, some level of risk. I don't know, I'm going to leave that alone. And so I would say take the vaccine if it's within if it's within your means and you've done you sit down and think about what's the pluses and minuses of taking it.
Okay.
I agree with that. To the concept, one way you could look at this question, should we not take the vaccine at all? That could be a question saying, should we just let nature run its course and get herd immunity? That will be a devastation effect on the amount of lives that are lost, the amount of families that are damaged and destroyed, when in fact we have something that could prevent that. And so with that said, I don't think just letting, and some countries have tried that.
Yeah.
And they found that it wasn't such a good idea.
Yeah. Okay. All right. Because this vaccine has not been out long, what comfort can be given to those that fear irreversible side effects that may come, say, maybe a year to 5 years from now?
So I'll just say, good question, because I don't know what 5 years from now is going to hold. That's a legitimate question, and I don't think anyone can answer that question. But to the point that this vaccine has not been out long, that part is true as well. But I can tell you that the idea of developing vaccines of this nature did not start 1 year ago.
The technology.
The technology has been there. We mentioned SARS-CoV-1, that was 20 years ago. Vaccination technology, working toward this type of vaccine, has been in the works even longer. And you know, small things that you hear in the news that kind of may fly by us over time, we'll say something like the genetic code or genome sequencing and stuff like that, that man, I would pay attention to. All of these things help to increase our knowledge base that we build on and we build on. And then so that's part of the reason why they were able to take some of the things that we had learned from the SARS and the COVID-1 and the MERS to then build on that and start applying it very quickly. And part of the reason why this got to a point of being available fast were a couple of different things. Number one is that I will say that in terms of safety, they did not skip steps. They did not. They did all of the steps that you would do to test any other vaccine coming to market. In a pandemic, there were so many people who were willing to participate in a trial that you were able to recruit and do the things that you would normally take years to do faster. That's number one. And number two is when it came time to develop this, the companies actually began to manufacture and to make the product.
Yeah, while they were testing.
While they were testing. And that's when we hear the description of saying Operation Warp Speed sounds like it went really, really fast. What it did do, it gave money to the companies to help offset some of their risk. So go ahead and make it, and even if it doesn't work, you're going to get paid. So your company is not going to lose money to do it. Fortunately, we had a better than expected result. The goal was to get in the 55% range if it was successful. If it's better than 55%, the plan was we'll take it. We're going to buy what you make. Even if it doesn't work, you're good for it. You're going to have your losses protected. It just so happened we were fortunate that it was 90% effective, and they had made millions of doses ahead of time. So when it got authorized, not approved, let me clarify that. When it got authorized, they were able to say, okay, authorized on Friday, roll out on Monday. Usually it would be authorized, now let's get approval process, now let's start manufacturing. So that was part of the things why it seemed like it was fast.
Okay, all right. Is the vaccine being improved and tested constantly? If so, what would be a reasonable amount of time to wait to feel safer in taking the vaccine?
Yeah, there's I've been kind of almost fascinated with this, almost to the point of obsession. But there's, Dr. Greenfield spoke about the variants, the UK variant, the South African variant, I think the Brazil variant was the other one. And so, to my understanding, you can correct me if I'm wrong, Dr. Greenfield, Pfizer tested their vaccine effectiveness against those variants outside of, and I think it's relatively, if I'm not, it retained its effectiveness, whereas Moderna, they found that there may be some, not as effective. You provide some effectiveness, or it still works basically to a certain extent, but they're going to go back and retool it a little bit and provide boosters. And so the companies, like Dr. Greenfield said, these are viruses, and so they're going to mutate all the time. And so it's the same reason why you don't get the same flu shot every year. They'll go back and take a census of what's the most current, strains of the virus, if you will, that's available, and then they'll go back. That's why some years the flu vaccine looks like it works very well. In other years, it seems like it didn't get anything, and so because you have emergent strains. And so the good part about this, if there is a light in the amount of darkness that we've all experienced at some level, is that people are, if for probably maybe the first time ever in modern medicine, they're constantly, they're pouring these resources into prevention for a change instead of treatment. And so these companies, particularly Moderna and Pfizer, are the only two right now, but AstraZeneca, Johnson & Johnson have vaccines on the way as well. They're looking at these variations as well. And so as time goes forward, they're going to start targeting those as well, sort of like with your flu vaccine, I would imagine.
Right. And I will say that the vaccines that are currently available in the state right now are the Pfizer vaccine and the Moderna vaccine. And you really don't have a situation where you can go pick and choose.
Yeah, yeah.
So the two vaccines that are available, the Pfizer vaccine required some very cold temperatures that can only be handled in certain hospitals. And it usually was the larger hospitals, and those hospitals happen to be in the central part of the state and the northern part of the state. So if, say, for example, you wanted the Pfizer vaccine and you were down in the southern part of the state, that might not necessarily have been an option for you.
Yeah.
The Moderna vaccine could be controlled at more reasonable temperatures, and more hospitals and pharmacies were able to handle that. And so they're sort of distributed across the state. And it's not necessarily a situation where you can say, well, I think I'm going to pick and choose that.
Right.
So a couple of take-home points. Number one, when you start with one, the Pfizer's 2 shots, come back 3 weeks later, get the second. With the Moderna, start with one, come back 4 weeks later, get the other. Don't mix them up. Okay? The Johnson & Johnson vaccine, which is coming, is a one-shot deal. And you say, well, is one better than two? I would argue that getting the vaccine in the arm is better than not getting the vaccine in the arm.
Right.
And so the sooner we can get more people vaccinated, the sooner the herd is vaccinated, the sooner we can get through.
Okay, all right. All right, final question for the night. If you already have an autoimmune disease and taking meds such as methotrexate, would it be safe to take the vaccine? Before you all answer that, and I think that kind of even speaks to, I know this question mentions an autoimmune disease, but also speak to other pre-existing conditions.
Yeah, it doesn't. So that's a great question, actually. And so what we know is that patients who have autoimmune diseases, whether it's sarcoidosis, lupus, they are considered to be immunosuppressed. And so because they usually have to take some type of immune modulating medications, or what they call them in our profession, in the healthcare profession, but prednisone, mycophenolate, these types of medication, methotrexate. So it would be recommended at this time that you go ahead and get it. Now, we don't know, and we don't have a lot of information available about how the immune systems of patients who are considered to be immunosuppressed, which would include patients who have HIV or other issues as well. But it is recommended that you go ahead and get it.
Okay, all right. Dr. Greenfield, did you want to speak to that?
Right. One other special population that we start talking about, people who have other medical conditions, autoimmune disorders. We don't know what the long term, but we do know that they're at increased risk because severe disease, because they may often be on a steroid or some medication that will suppress their immune system. People who have hypertension are at increased risk of severe disease. Obesity, increased risk for severe disease. Diabetes, increased risk for severe disease. I'm an obstetrician gynecologist by training. So there's another population that's special to me, and that's pregnant women. Okay? Should pregnant women get the vaccine? Pregnant women were not included in the study. Okay? But the consensus is that if you have to assess what your personal risk is, it is not something, how can I say that? It is something that I do recommend for my patients. Let me put it to you that way. Because pregnancy can result in a decreased immune response. What we don't know is exactly what the immune response will be from the vaccine and how it will impact the pregnancy. So there are some unknowns. But what I do know about what COVID will do to a pregnancy is that while it may not necessarily increase your risk of contracting it, if you do, pregnant women have a more severe case than non-pregnant women. Increased risk of preterm labor, preterm birth, and an increased risk of death compared to non-pregnant women.
Okay, all right. Okay, well, first of all, let me thank Dr. Tinsley and Dr. Greenfield for sharing with us tonight. Before we close out, I do want to give them an opportunity, if they have any closing comments, any closing thoughts you may want to leave with those viewing tonight, if there's anything?
Yeah, I'll be quick, Pastor. Something I don't recall being touched on. A lot of people have asked me about availability for vaccinating children. They're starting to do studies right now. Pfizer has recently increased, I think, to 10 or 12 years of age to up to 18, and so that's going to be the next group. And so it's going to be a little bit of time. I know that's particularly of concern for us who have school-age children, from kindergarten up to 12th grade or whatnot. And so more information is going to be available. The good part about it, and I think we talked about this in our conversation prior to the streaming event this evening, was that the good part about it is kids aren't as affected overall from contracting COVID. But what we have noticed, there is a risk if they do get infected. It's a small risk. They may have an adverse effect, but overall, they tend to do better. Now, the reason behind that still remains unknown at this time, but as time progresses, hopefully throughout this year, maybe the first of next year, they may be able to extend that. But I really want to encourage everyone, again, to have those conversations. Don't be afraid of the information. Dr. Greenfield said there's a lot of information, a lot of disinformation out there. Know your sources, trust your sources. Don't be afraid to ask questions. It's nothing, there's no dumb questions. There's only a lack of seeking knowledge. And so you always want to make sure you're enlightening yourself, getting good information. If you don't know, don't be afraid to ask a healthcare provider, a qualified healthcare provider, a physician, a pharmacist, APNs. All of these individuals are good resources of information. So.
Okay, all right.
And I guess the last things I'd like to leave with the group, number one is this vaccine is not the virus itself. It
Absolutely.
cannot give you COVID. It is not a weakened version of the virus that is being given to you. It is not a live version of the virus that is being given to you. It is not the virus at all. It is simply a message, a small protein that's a message to tell the body, teaches the body to recognize the virus when it sees it. So fear of the vaccination giving you the virus or giving you COVID, that is not possible with vaccines that we have. That's number one. And the last thing I would say is I have an 80-year-old mother who she's a 2-time cancer survivor and has had a heart attack. And I love this woman more than life itself. And she's not the person who's going to be able to necessarily get on the computer and scroll the internet, find a website, do the link, match it up, get in the car and drive down the street and get the vaccine. But she's in that high-risk group and she's eligible. So I just challenge everyone who's listening, as you're thinking about not just you, think about those folks who are around you.
Absolutely.
Who would like to be on this meeting, but they don't have streaming access. They don't have transportation. They don't have access to information that you may have that we may take for granted. So I just challenge everyone, I would encourage everyone to get vaccinated, but I also encourage everyone to do right by our neighbors.
Absolutely.
And help them, because even if you don't want it, they might want it and need help getting it.
Yeah, okay. That's a good point. Certainly, we have to be mindful that there are, again, some who are not as fortunate as we are, and the Bible does tell us that we have to, the strong have to bear the infirmities of the weak. And so I want you all to certainly those who are watching tonight, I want you to take heed to the information that you've heard tonight. Again, I want to thank Dr. Tinsley, thank Dr. Greenfield for taking time out of their schedules to come and to share with us. I'm certainly appreciative for this information. And as you are considering and taking all this in, I want you to first of all, just be mindful of those who are afraid, those who are nervous about taking it. I believe that God has put doctors and pharmacists in positions to where they know what they're doing. They've gone to school, and God has afforded them that opportunity. So I think if you listen to your own physician, to these men who have shared with us tonight, and others, as that, information on these websites, the CDC website, and a couple others that Dr. Greenfield mentioned. And certainly, I think you will certainly get a better understanding of this vaccine. So again, to all of you who have joined us tonight, thank you so much. Again, if you have any questions, we ask that you would call the church, email us. Our email is cb.collier@mtpisgajville.com. If you have any questions, again, you can send those questions via email. I'll reach out to Dr. Tinsley, Dr. Greenfield, and we will get you an answer as soon as we can. But again, to all of you who have joined us, again, we thank you. Hope this has been very informative for you tonight, and so I pray that you will have a wonderful evening. And for those Mount Pisgah members, tomorrow night at 7 p.m. we will be in Bible study virtually. Pastor G will be teaching tomorrow night and sharing as he has done the last few months, and so we want you all to join us via live stream, Facebook, and YouTube on tomorrow night. So again, y'all have a wonderful night, and y'all be blessed. That's it.